do I know that I have chronic inflammation versus acute inflammation?
Well, so acute, red hot on fire, and then chronic smoldering, okay? How do you as the patient know? Well, sometimes it's hard to know, but usually it's the duration. If you've been suffering more than 4 to 6 weeks, definitely 6 to 8 weeks, you're out of that acute inflammatory stage. The body, like the way the platelet works with its growth factors, we call it's a healing cascade. And that healing cascade should bring about the resolution of pain by the time you're at about 6 weeks.
And is pain the only indication of acute versus chronic, or it's fully repaired? Is that typically how your body's...
You only get about 75% of the actual repair of the tissue by the time you're out 6 weeks. It can take up to a year for totally normal collagen to lay down. So a normal tendon to regenerate and look normal. But the pain part of it gets better faster. There's other things, obviously, that go along with pain. Performance, right? So that's your bailiwick is performance. So if, let's say I've got a lineman and he needs that explosive power, right? And he's been having issues with his medial retinaculum on his knee. And I can shut the pain off, but if he can't get that power back, he's still in that chronic inflammatory stage. So in sometimes, in order to rebuild that kinetic chain, you need to shut the pain off. So usually the pain is kind of the first thing to get away, and then you start building back some of that power.